My name is Marie Peralta. I'm here to explain what cultural competency and humility means to me and how I would apply evidence based cultural considerations when caring for a group of individuals whose background, beliefs, or values differ from my own. Cultural competency means having the knowledge and skills to provide care that respects diverse backgrounds, while cultural humility emphasizes ongoing self reflection, openness, and recognition of power imbalances. Together, they guide providers to deliver safe, equitable, and respectful care across differences. To me, cultural competency is the ability to understand, communicate with, and effectively interact with patients across cultures by integrating awareness of cultural differences into clinical practice. It involves learning about diverse traditions, health beliefs, and values to reduce disparities and improve outcomes. Cultural humility, however, goes further. It is a lifelong process of self reflection and self critique, acknowledging that providers cannot be fully competent in another's culture but can remain open, curious, and respectful. It requires recognizing systemic inequities and committing to shared decision making that honors patients' perspectives. For example, when caring for a patient from a Hispanic background with diabetes, cultural competency might involve understanding dietary traditions that influence glucose control. Cultural humility would mean asking the patient how food is prepared in their household, listening without judgment, and collaboratively identifying healthier substitutions that align with their cultural practices. This approach avoids imposing my own assumptions and instead builds trust. Evidence shows that cultural disparities significantly affect health outcomes. For instance, Hispanic and Black populations in the United States have higher rates of uncontrolled hypertension and diabetes compared to white populations, often due to barriers such as language differences, limited access to care, and socioeconomic inequities. A 2025 study by Moore and colleagues found that integrating cultural competence and humility into public health programs improve engagement and reduce disparities in chronic disease management. This suggests that solutions must include both provider level strategies, interpreter services, culturally tailored education, and system level changes such as equitable access to resources. Reflecting on this personally as a provider, I recognize that my own background and biases may shape how I interpret patient behaviors. Practicing cultural humility means continually questioning those assumptions, seeking feedback, and adapting care plans to align with the patient's lived experience. By combining evidence based guidelines with cultural considerations, I can better address disparities and ensure care is both effective and respectful.